name is Toni Hebda. I am honored to be with you here today. I still consider myself to be a bit of a neophyte within Second Life, so I'm still a little odd and a bit nervous as I stand before you today because I know that there are so many great things that everyone else is doing. I do want to express my gratitude to the organizers of the Virtual World's Best Practice in Education Conference for this opportunity to speak with you today, and to my colleagues shown on the slide, Carolyn Sipes, Dee McGonigal, Kathleen Hunter, Taryn Hill, and Karen West, without whom I would not be able to be here today to speak to you on our effort on this project and our attempt to assess and promote informatics competencies among our fellow faculty. This is within our MSN program at Chamberlain College of Nursing. Chamberlain's home is actually in Illinois, but our program is entirely online. And I know that the perception for many nurses, especially nurse faculty, is that if you teach online, you therefore have all of the informatics knowledge and skills that you need. However, we have found that to be less than the case. So, to give you a little bit of background about our project, informatics competencies are needed by all nurses. But competency levels vary vastly among nurses, and that includes among nursing faculty. So we asked that our faculty at our one program self-assess competencies prior to the rollout of a revised graduate-level introductory nursing informatics course for just our MSN population. The self-assessment tool was already developed and validated. Our graduate core nursing informatics course had been revised to include Second Life experiences for the students as one means to help students develop informatics competencies and to appreciate how nursing informatics skills could and should be part of their nursing practice. During the process, there were multiple meetings with the full-time graduate faculty to get their buy-in and also to get them to suggest particular examples that they would like to see integrated in the course within Second Life that would be reflective of nursing informatics competencies that they used and found appropriate within their specialty areas. So the people named on the slide are what we refer to ourselves as the Nursing Informatics Research Team at Chamberlain. And we had already developed the instrument that was used for the self-assessment. And it was based upon work done by the TIGER Initiative, which stands for Technology, Informatics, Guiding Education, Reform. And for those of you who would like to have further information about the TIGER Initiative, you may find it on the Healthcare Information and Management Systems Society website, otherwise known as HIMSS.org website. So, what we also felt necessary for our colleagues and also appropriate for the presentation today was to define nursing informatics, because many people today just think, oh, that's the computer nurse, and oh, you deal with data. But nursing informatics, as defined by the American Medical Informatics Association, their definition is taken by the International Medical Informatics Association Special Interest Group on Nursing Informatics that came out in 2009. And they defined it as the science and practice that integrates nursing, its information and knowledge with management of information and communication technologies to promote the health of people, families, and communities worldwide. There are a number of definitions for nursing informatics that are floating around. And while we'll talk about another, I won't spend a great deal of time today in discussing the various definitions that are still out there. As of March 15th of this year, on the HIMSS website, they are using the 2015 American Nurses Association definition, which we'll get to very briefly. But let me back up a moment for the one defined by the American Medical Informatics Association and the International Medical Informatics Association. Not only do they have the definition shown on the slide, but they're talking about the core work areas that are listed on their slide for nursing informatics that include concept representation and standards to support practice, research, and education, data and communication standards that are needed to create an interoperable national data infrastructure. And I don't know if anyone here is from the international community. We still have a long way to go in the United States to achieve a truly interoperable health information network. Another work focus area, as defined by the AMIA website, are research methods to disseminate new knowledge. Yet another focus area, presentation and retrieval of information to support safe, patient-centered care. Workflow needs, the development, design, and implementation of technology, and the last work focus listed on that website are efforts to define healthcare policy to advance health and healthcare. So some of those help to give you a broad understanding of how involved nursing informatics actually is. So just to give that as further background for our project. So on the Healthcare Information and Management Systems Society website this year, they list the 2015 American Nurses Association definition. And that is the one that is favored by myself and my colleagues because it is published in the American Nurses Association Scope and Standards of Practice for Nursing Informatics. So as you look at this definition, it focuses on the integration of nursing science, computer science, and multiple information and analytic sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. It supports consumers, patients, and the interprofessional healthcare team, as well as other stakeholders in their decision-making and in all roles and settings to achieve the desired outcomes. The support is accomplished through the use of information structures, information processes, and information technology. So once again, this is the definition that myself and my colleagues favor. It also provides the framework for American Nurses Association practice and for our credentialing exam. The American Nurses Credentialing Center is the specialty certification examination arm of the American Nurses Association, and we do have a certification exam for informatics nursing. So the premise for our project then is once again that all nurses require informatics competencies. And faculty must also have nursing informatics competencies in order to impart those competencies into graduates. There are a number of organizations within the U.S. and, of course, abroad that advocate a technologically prepared workforce. In the United States, there is the Institute of Medicine, and the Institute of Medicine has published a number of reports to advocate for the inclusion of informatics competencies, including the 2010 Future of Nursing Report. Some of the other organizations include QSIN, which is the Quality Safety Education for Nurses Initiative. They've identified knowledge and skills and attitudes that are required for nurses to be appropriately prepared. The National League for Nursing came out with a position paper in 2015 entitled A Vision for Changing the Faculty Role, Preparing Students for the Technological World of Healthcare. Of course, the American Nurses Association, which I've already mentioned because they have the scope and standards of practice. The American Association of Colleges of Nursing has a number of documents that also identify the levels of practice or appropriate outcomes for students prepared at the baccalaureate level as well as at the master's level and the doctoral level. So we have many, many different organizations that advocate. And of course, in today's technological healthcare environment, we have the electronic health record, which is one of the first things that most people consider. But we also have a number of very technical devices that are out there that our nurses need to be prepared to work with. But we also need to help them understand the importance of data and the use of data to inform practice, to work towards knowledge and also wisdom, and integrate that in their practice to improve patient care for not only the individual patient but for aggregate patients, and to help improve the American healthcare delivery system. So we take on a rather large role. So nursing informatics is much more than just about data management, and the scope of it still is unfortunately a mystery to many of our colleagues. We would expect to have our colleagues much better informed than perhaps the general public, but we're getting there. There's still a lack of faculty comfort having to do with what nursing informatics knowledge and skills are, and because of that, sometimes we're just not seeing the integration throughout the curriculum that we would like to see or we know is needed. And myself and my colleagues are concerned about gaps within the curriculum so that we're not necessarily imbuing our graduates with all of the outcomes that we should be seeing in the level of preparation. So on our TANIC tool, which is the self-assessment competency tool that myself and my colleagues developed earlier, it is coming from the TIGER initiative that developed a list of skills that every practicing nurse should have. And what we did is we operationalized the tool. So we'll talk further about that. It is a copyrighted tool that we'll be happy to share upon request. And it stands for the TIGER Assessment of Nursing Informatics Competencies, the name that we gave it. So once again, we're in a very technological society. We need to have our colleagues adequately knowledgeable and prepared so that they can facilitate the journey and imbue the necessary skills. But as long as the faculty and administrators are unclear as to what informatics is and what informatics competencies are required by every practicing nurse, let alone on each level, then we will continue to have gaps in the curriculum and the knowledge sets. Many times our students come into some of our MSN courses more technologically adept and having more informatics skills from their work experience than some of the faculty who teach the courses. And for our graduate level MSN Core Informatics course that I was referencing earlier, what we have done is we have incorporated the TANIC tool, the self-assessment of the informatics competencies, in that for the students to do to help increase their awareness of what these competency levels are and need to be. So a few additional words about the TANIC instrument. So once again, there was a list compiled in 2009 by the Tiger Initiative, and it has skills in 3 particular areas. We have computer skills, information literacy skills, and clinical information system skills. So we operationalized the list, and we maintained the different categories or groupings of skills. What we did, though, is as a group of researchers, our initial review of the Tiger Initiative list was that we looked at the list of competencies and removed what we felt were duplicative items and combined the items of similar content. And then for the second and third round of reviews, these were conducted by 2 separate sets of 3 experts in nursing informatics. During the second round, the list that was compiled by us during round 1 was examined for items that needed to be retained or, in some cases, added. The resulting items were reworded to reflect measurable behaviors and then were subjected to a third round of reviews to establish content validity using the Content Validity Index CVI methodology. Our results were that CVIs demonstrated moderate validity for the instrument, and items not deemed relevant to the objective of the instrument were deleted, reducing the number of items on the instrument. The instrument then was piloted by posting an invitation on the online discussion forum of a nursing informatics organization. And invitation was extended to a group approximately at the same time who was completing a week-long nursing informatics course. There were 184 respondents who were involved in the pilot of this instrument. Most ranked themselves as expert on the majority of items, although a lesser degree of competence was seen on items related to information literacy. And for the purpose of this pilot project, looking at informatics competencies among faculty, we also as a group looked at some of the items that we felt were particularly relevant for faculty that we were asking to come into the Second Life environment. And I would venture to say for the majority of these people, it was perhaps their first exposure to the Second Life environment. So our pilot project, once again, came from a goal to enhance informatics knowledge and skill among our faculty, our graduate level faculty. And well, we wanted to imbue that knowledge and skill set among all of the faculty, including the many adjuncts who teach for us. Our pilot involved only the core group of full-time MSN faculty. We felt that their buy-in and support was essential for the success of the revised core informatics course. And just to give a little break from all of the text, this particular slide depicts an activity that is an integral part of the stations that the students are expected to visit within the Second Life environment for their core informatics course. And given the fact that the course expects students to enter and navigate the Second Life environment to complete these activities, it was felt that, of course, faculty should be able to do the same. For one thing, how can you possibly address questions that the students have or comments if you yourself have not been there? And this slide depicts another station that we had. I believe that when we were talking about setting up the course, one of the things that we expected students to do was to upload a presentation, a PowerPoint presentation. So I believe this is a depiction of this. And since the presentation focuses on the faculty orientation, I'm not going to delve further into the particular student course right now. But our plan for this pilot, as listed on this slide and the next one, how were we going to inform our colleagues? Well, our first idea was that we would ask them to review 2 webinars that Carolyn Sipes, my colleague, and I had developed for the American Association of Colleges of Nursing, and the content was on nursing informatics. And then we would, and those were offered for continuing education, which of course are always important for us as we work to maintain the credentials for our licensure. And then we would ask this faculty to complete a self-learning module. And in the self-learning module, it included a review of the following documents: the task force of the Health Sciences Interest Group of the American Library Association, and that was a 2014 publication, the Information Literacy Competency Standards for Nursing, published in CNRL News. And also the National League for Nursing 2015 Position Statement, A Vision for the Changing Faculty Role, Preparing Students for the Technological World of Healthcare. And then we asked them to complete an online orientation of the school's virtual learning environment in Second Life. We have several islands. We have a very nice environment. Although coming here, we see that there are many other great features to incorporate. So next on our plan, after the faculty oriented to Second Life, was to have that same set of faculty demonstrate the ability to teach students involved in Second Life activities in our core informatics course. And based on what we found on their self-assessment on our TANIC tool, our next planned activity was to have faculty complete a tailored development plan. And then perhaps we were being overly ambitious, but we felt that it would be appropriate to provide input to revise faculty descriptions, job descriptions, to include nursing informatics competencies. Our thought behind that is that if it is an integral part of your job description, it would be greater incentive to ensure that you indeed did have those necessary competencies. And then faculty evaluations would also likewise be revised to incorporate nursing informatics competencies. So the pilot plan and the plan in review. Faculty did indeed complete the review of the webinars, the learning module, and the orientation to Second Life and the self-assessment TANIC tool. However, what failed to happen is the tailored faculty development programs and a second reassessment using the TANIC instrument to demonstrate a higher level of self-perceived competency. And while we felt that the plan was good, where we felt short was that we failed to adequately consider a number of issues, including time. I don't need to tell people that are here, because it's a conference that focuses on education practices, that there are never enough hours in the day. So what we found was that our core faculty had other teaching responsibilities, and because of that, most had neither the time nor the inclination to take one of our sections of the core informatics course on as overload. So it was a disappointment for us. But obviously one doesn't get to everything that you would like. So a sound plan, so faculty time was a major constraint. And in some cases, when we have competing initiatives and faculty interest, again, just simply not enough hours in a day. Among some of the other initiatives that are going on at the same time is that Chamberlain highly encourages our faculty to obtain certification offered through the National League for Nursing as in nursing, to become a certified nurse educator through the National League for Nursing. We also ask that our faculty complete a master instruction course. Well, actually, it's a series of courses, and to work to certification in that area. And of course, we encourage certification in respective areas of practice. Myself, in addition to being certified as a nurse educator by the National League for Nursing, I have certification in informatics nursing. So it's just a question of how many hours in a day. And despite our orientation to the Second Life environment, faculty did not universally embrace it. So that was a disappointment for us. And we also had a number of faculty who expressed their perception that nursing informatics was hard. Not that we were expecting them all to become an informatics nurse, but merely to become adequately aware of how informatics competencies are threaded throughout the role of nurse educator as well as every practicing nurse. So some people still had some difficulty seeing how nursing and informatics fit within the larger arena. And limited project support largely because of the other demands and the lack of release time. Obviously, if everyone had release time from their normal responsibilities, who would take them on? So among our suggestions for how we could deal with this in a better way, well, we operate on 8-week sessions, so that makes it very tough. We don't have summers off, obviously, and the longest period of time we typically have off in between sessions is 2 weeks at the end of the year. We would like to break some of this exposure to the Second Life environment and integration of nursing informatics competency into smaller sessions for faculty. One way that we would suggest doing this is every session we have a faculty forum where our faculty are introduced to changes in policies and practices. So we would like to almost sneak in a little bit about nursing informatics in each one of those sessions. We do plan to continue our efforts to educate our colleagues and present additional continuing education programs. And also to present suggestions for how they might adapt, say, certain technologies and informatics competencies within their practice to improve their time management and come out with better outcomes. As to our plan to educate all of our visiting professors, our biggest stumbling block there was that we were told that we could not contractually request that our adjuncts take on the added time for the Second Life orientation as well as the rest of our pilot. Again, a disappointment. Again, we plan to continue in offering that as an opportunity because we're hoping that people that are interested enough to teach the core informatics course will also be interested to continue to develop their informatics competencies. So it was an interesting experience. We hope to continue. We are still very interested in looking at competencies overall. So our group has looked at competencies of our incoming students. We have another competency document that is for our informatics specialist track, and we are still committed to looking at faculty competencies and ways that we can improve them. Some of the resources that were used for the presentation or seminal to the support of this project are listed here and are available upon request. And I also need to apologize to people because in many cases there were references that I did not include but were discussed within the presentation. So my colleague in my Second Life world is here today as a mentor. Her avatar is Jackie Bean Galaxy, and she is a very creative, enthusiastic individual who is very interested in using the Second Life environment and not afraid to look at technological skills. So we're very lucky to have her. And what I have here as one of my closing slides is a picture of our students that are completing their practicum experience, because we do also have a practicum experience that we offer to students in our informatics track, as well as our educator and executive track programs. It's not a universally completed. Yes, thank you. I like that idea that we didn't have hourly compensation to attend. Maybe we can do that via a grant. Thank you for that suggestion. And I want to open this up for further suggestions. But to finish, we do have a practicum that's available to some of our students as an online program. We have a situation where some of the students find it very difficult to find an adequately prepared mentor in their geographic location, or in some cases they were unable to secure a contract to do their practicum on the ground. So we offered them a practicum opportunity via Second Life so that they could still graduate in a timely fashion. And this is at the conclusion of the practicum experience, and we started to have students don gowns because there were comments that they would like to have an online graduation, which we have not offered as yet. We have traditional graduation. But the students really enjoy their Second Life practicum experience. They enter into it, for the most part, very unsure as to what they'll encounter, but our program has been essentially asynchronous up to this point in time, so they love the opportunity to interact with each other and to interact with the other tracks real time. So we have a lot of things we'd like to develop, and we are integrating Second Life experiences of different magnitude in other graduate level courses. I do want to thank everyone for being in attendance, and I really look forward now to questions as well as further comments.